would like to give a kiss touch to this talk. A romantic evening, and the word appears very beautiful, but here kiss refers to keep it short and specific. So I'll just focus on this topic called Ayurveda mantra for mental health. See, when we talk about health, this is a very diversified, vast, multifaceted, and it is very easy to define. But when it comes to practice, or when we see people attending your OPD or attending your clinics, it's really difficult to assess that an individual is healthy. Because there are so many components of health which you need to consider before you define an individual as healthy. Like for example, an individual, an athlete comes with a history of sprain. He is in a transient phase of disability. There is an individual who has committed some crime, goes to a prison, but he is totally asymptomatic. From a social perspective, he may not be totally called as healthy. So there are so many factors which need to be considered whenever you define an individual as health. So that is why defining health may be very easy, but assessing health sometimes need to be considered by looking into various factors. And when we define health as per WHO, we say that it's a state of physical, mental and social well-being, not merely the absence of disease. See, as per Ayurveda, we also say that when we talk about health and disease, we talk in terms of doshas. So, sometimes, until unless there is an absence of disease, this cannot be totally defined, because, again, there could be coexisting. This health and disease could coexist, and that is why defining itself becomes a major challenge. So, we always, whenever we want to define health, we always talk about this quote available in Shri Sutra. It says it's a balanced state or equilibrium state of dosha, dhatu, mala and agni. And the second one talks about the prasannata in terms of atma, indriya and sattva. But in a clinical setup, when a patient or an individual comes to you, how do you assess them? This is the real challenge. Okay, you could take a little bit of stress and strain in defining an individual as maybe physically healthy. You can ask him like about his appetite, about his digestion, about his sleep, etc. and you could easily assess the physical health. But what about the second aspect of prasanna, atma, indriya and mana? How do you assess this? And how do you define prasannata of, suppose if you scan an individual, how do you say that he is atma prasanna? Whether his atma is prasanna or not? Whether his indriya is prasanna or not? Or whether his manas is prasanna or not? See, very often we translate this atma prasannata as the sense of spirit or soul. It's the happiness of soul. See, basically, the soul does not enjoy either the disease or happiness. It is the self which needs to be understood here. It is the body or the self which is the atma. So the self-satisfaction in terms of the self, orientation to place that in person, and his ability to understand himself itself is called as atma, not the soul or the spirit that we very normally translate. And the sensory perception is towards indriya. And more importantly, when it talks of manas, it is not just the absence of a disease. It is something beyond this. So that is why the word is used as prasannata. It is not the samavastha of this, but it is the prasanna avastha of this, which depicts the importance of being well-being of an individual. So how do you assess this? I think there are some basic parameters of the physical components, and similarly, when it comes to the presence of the psychological symptoms, in terms of psychological health or the mental health, we always say that it is just beyond the absence of a mental disease. It is being how you are comfortable with yourself, how you are able to adjust to the surroundings, and how you are able to contribute to the surroundings. So when it comes to mental health, see, mental health is defined as a state of where an individual realizes his own potentials, where an individual is able to cope up with the stresses of life, where an individual can contribute to the society, and an individual can always be productive and good. So it is something beyond just being absence of disease. It is something where you realize your potentials and you are able to contribute. And when it comes to Ayurveda, what Ayurveda speaks about mental health and how do you define mental health? See, there are various references that you feel in terms of the reference, especially in case of the Kayas, the Sattvika Kaya. If you look at the Lakshanas of Sattvika Kaya, where he says that one is able to realize himself, where he is able to balance himself, know about the truth and untruth of life, able to know what is right and wrong, has a sense of this society and the culture, and is able to have this balance of mind. It is what is defined in the Kaya, defined in Samhitas. And also, you also get a reference in Charaka Samhita where you say Vigata Unmad Lakshanas. So, what is the symptom that a person is cured of a mental disease? And if you look into this particular quote, it says as Prasanna Ahmedabad Buddhi Atma Manasa Tatha Dhatunam Prakritiastam Vigata Unmad Lakshana. It says that when a person attains this sense of well-being, in terms of his cognitive functioning, in terms of his perception, in terms of his intelligence, you say that the person is said to be physically healthy. And how do you maintain health? See, basically, Ayurveda speaks about prevention as well as the cure of disease. So, this particular presentation is more how we can use the concepts of Ayurveda in preventing mental disorders. And for this, most practical applicable principle or the concept is what is told in Charaka Samhita as well as in Ashtanga Hridaya, Sutrasthana 4th chapter. Nityam Hita Ahara Vidhar Sevi Samikshakari Vishesh Asaktaha Dataha Samaha Satyaparaha Kshamavan Apupa Sevicha Bhavantyayo. I think there could never be any better principles than this to prevent any disease and particularly for the mental disorders. As you all know that this life is made up of the Atma, Sattva and the Shri. And all these principles are either directly or indirectly focused on maintaining these three components. Similarly, when we talk about Upastambhas, maybe Ahara, Nidra and Brahmacharya. The Ahara is more towards balancing the Pitta dosha. The Nidra is for balance of the Kapha dosha. And Brahmacharya, which includes all the ethical living, including the Vivek Dharana, is for maintaining the Vata dosha. So it's not only for maintenance of the Atma, Indriya and Sattva, but also for the maintenance of the doshas. So based on this, probably I have restricted a few of the important therapeutic lifestyle changes which is important for balancing or maintaining or preventing the mental disorders. It includes food and nutrition, exercise, living in tune with the nature, relationships, recreation and relaxation, stress management, various important religious and spiritual involvement and contribution and service to the others. See, when it comes to food and nutrition, it is said as Ahara Shuddham Sattva Shuddhi. But what is meant by a sensible eating? One need to understand his digestive capacity, one need to understand his own prakriti, understand where he is staying, and what is the season, and based on that, the traditional diet that we think of. So when you say traditional diet, it refers to that diet probably which has been following and which we probably use at our routine. Because if you use excessive of carbonated, preserved, refined foods, it can have an immense effect on the growth and development of the brain. That is why it is rightly said that because this food is not only important for our digestive system but also for the brain health. Because it is said that one of the important neurotransmitter, which is the serotonin, 95% of this is secreted in the gastrointestinal tract. And this serotonin is important for good sleep, to be relaxed, and to see that you are always functioning properly. So that is why this food plays a very, very vital role in terms of the mental health. See, there are some important foods which will be very important for the brain health, especially if you look into the normal diet of milk and the ghee. Because our body, especially the brain, needs energy. and this energy comes from amino acids and fats. And to have amino acids, you have cheetah or milk, and to get the fat and for the growth and development of the neurons and for regeneration, you need fat in the form of milk. That is why it is very important that we can use some of the products like use of kushmata or milk aspida, because if you use this as a whole, along with the seeds, it has a potent antidepressant actions which relaxes your mind. You can use gooseberry for a daily routine, and this also can be very useful in maintenance of health, because all this not only maintains your gastrointestinal tract but also regulates your emotions. Plenty of work has been done on especially the omega-3 fatty acids, where you see that there are plenty of other food supplements which are said to be good for day, good for mental health, like zinc, vitamin D, etc. But we always recommend to use that like a probiotic, a food supplement. But sometimes when you use a product as a food supplement, the body sometimes do not accept it as a food. It may also reject it. So that is why if you can use these vitamin supplementation also as a part of food, it can prevent various type of disorders. Physical activity is very, very important because this will enhance your physical stability, bring you fitness, but also there are a lot of functioning like academic performance, the concentration, your cognitive increments, and the work efficiency. You can work much. It is said that one who is physically active can work 45% better than a normal person who do not do the exercise. So that is the importance of a physical exercise. See, now we always would like to live in an artificial nature. We want to live in a place which is artificially aerated, artificially lighted, and we always would like to have something which is artificial drinks. So instead of that, if we are able to stay in tune with the nature, be connected with the nature, because we are always under four walls and diverse to the nature. We are already separated from the nature, and that becomes a major cause for various disorders, because when you are not in tune with the nature, it disrupts your mind, it disrupts your mood, and especially the diurnal variation is totally disturbed. So that is why staying in tune with the nature, understanding the nature is very, very important. And nowadays you see a new digital technology where people are immersed into media. A recent study says that more than 3 hours are spent in front of TV and mobiles. For an individual, this is quite huge, and that could have a great impact on the growth and development, and will lead various types of cognitive deficiencies. And it not only changes the way we live, way we communicate, it's also researched that there's enormous changes happening in the brain by the excessive use of these multimedia, especially mobiles and the televisions. I think one of the most important things that God has given us to maintain a good health is probably a good relationship with the family and friends. Because we, being the mental social beings, we are only interdependent cultures. We are related to our system in form of getting connected. And when we are connected, it can always give a good benefit to the individuals. It is said that one who has a good social connection, one who has not having of the social network, the social relationship, if it is proper, probably it can count to 1/3 of the health outcome. Sometimes much better than a treatment itself. So a good support is very, very important, and good relationship can prevent from major disorders like depression, Alzheimer's, and other Parkinson's disorders. Always involve yourself in some enjoyable acts which we call as recreation. To be creative, always have some recreational activities. One of the best things is probably sharing a humor or sharing with your family, some part of spending quality time with your family. This is always very important. So it is likely said that once a famous philosopher by name Stuart Mill went to a state of depression at the age of 18 or 20 years. But he took up various recreational activities like painting, art, etc., and he was able to come out of these problems. And since then, he became one of the leading philosophers of 19th century. So recreation always keeps you recharged. Recreation always keeps you motivated, inspired, and it can easily help you to come out of any problems. So always have some recreation. It is very important to take care of your health. You need to relax. You need to know what are the tips for relaxing yourself. Basically, our body is meant to be active and mind to be relaxed. But what we are doing now, little ulta. We are keeping our body totally sedentary and always our mind is completely fluctuating. So have a sense of understanding where you keep yourself physically active and mentally stable and relaxed. Very, very important. As a health professionals, we also need to maintain our health by involving in such activities. It is also said that one who is involved in religious and spiritual involvement will tend to live 7 years more than the people who do not have this intention or towards inclination towards a spiritual conscience. It says that probably if you are inclined towards some physical activity, spiritual activities in terms of helping others, charity, forgiveness, donating, etc., probably it can have a lot of positive impact on individuals. If it can be done with love and compassion and forgiveness, it will have a lot of healthy effect. And when it is done with an intention of punishment or guilt, it could also have a negative impact. We always think that giving something to others is sacrifice. In fact, it is not a sacrifice because one who receives the benefit also gets benefited, but is the one who is the giver is benefited more when he involves in contributing to others. Because it gives him happiness, satisfaction, and a sense of social and spiritual maturity, which is very, very important in understanding himself, and that is why it is always seen that when you contribute, you are not only helping others, you are helping yourself. So that is why probably this is what I always tell to my clients based on this principles that is available in Ayurveda called as A, B, C, D, 4, 3, 2, 1. When A stands for getting away from distraction, know the purpose of your life and know why you are here. What is the goal of your life? Have good dreams. Work for the dreams. B, always have a good plan, a good variety of life. B, be happy, be cheerful, enjoy the thing that you are doing. And D, involved in some physical daily activities. 4, drink plenty of water. I'm not just saying it is 4 liters, but the message is that drink plenty of water. 3 times timely food is very, very important, balanced food. And it is said that, see, if you go to Ashtanga there, it is said that Lakkam Dinani Ye Yanti. It is important that you also analyze what you have done for the day. And wherever you have done good, appreciate yourself. And wherever you find that you could have done better, you can always have a new day, a new beginning to see that you can overcome this. And at least have at least one recreational activities, maybe singing, dancing, or reading, listening to music, which can always keep you happy, activated, and moving. To conclude, see, these are the concepts, probably which are not very new to most of us. But why is that we still don't give the importance or the focus to this particular things? I think the theme of this conference is rightly said that we need to realign the focus of health. We need to shift the focus from illness to wellness, from the towards Swasthavritta. It is very important that we need to understand, because the mindset of an individual is that whenever we think of health or happiness, we think that someone from the external authority, someone from outside are going to come, give some pill and help us. We don't realize it is we who can heal ourselves. If we can understand ourselves, we can always heal ourselves. With this, I conclude. Thank you.